What's going on, y'all? Bruce the Boss Brooks coming at you again, and today's topic of discussion is reopening schools in the midst of this COVID-19 pandemic. So here we go. So as I'm going through my Twitter feed today, I couldn't help but notice a CNN article highlighting how, as it stands since the reopening of the fall semester in the University of Alabama, they suddenly have 1,000 new cases of COVID amongst their student population. And it just reminds me of all of the other articles CNN had come out with, as well as MSNBC and all the other major networks since Georgia, for instance, reopened their schools for their in-person learning, and the stories that they were pumping out about the concerns. One of the students in the high school took a picture of all of these students in mass in the hallway. Let me show you that clip real quick. Go.
School in Dallas, Georgia by 15-year-old Hannah Waters. And it shows students transitioning between classes. You can see there, few are wearing masks and they are walking shoulder to shoulder through the halls. But the photo captures more than just the absence of social distancing. It really captures the fear felt by students, parents, and teachers alike that despite every district's best efforts, you can't control everything. Joining us now from Canton, Georgia with more on this story is NBC's Shaq Brewster. And Shaq, this story has really gripped America's attention because there's been punishment, extreme punishment imposed on that student who took the photo, but it also raises a lot of concerns about in-person learning this fall. Within just the past hour alone, we have news that 250 Georgia students and teachers now quarantined after the first week of school in the Cherokee County School District. What are people saying?
So you see the concern brought in the commentary there from that news story, the fear, the uncertainty, they're not social distancing, they're not wearing a mask. Cases are increasing, positive cases. Oh my God, we should be worried. We should be keeping these kids home. That's the argument we keep hearing from the mainstream media and these teacher unions. But then it reminds me of a story that MSNBC did just 3 weeks ago with some of the country's top pediatricians and their thoughts and recommendations on how the coronavirus or COVID-19 affects young people and their thoughts on reopening schools. Let me run that clip real quick.
As schools struggle with reopening safely, NBC News reached out to 5 top pediatricians across the country, a random sampling of doctors, to find out just how dangerous the coronavirus is for kids. Our experts agree. Most children don't get as sick as adults, and the serious complications are rare.
This has been a strange pandemic because usually for respiratory viruses, children are the first and the most substantially affected. And this has really been a flip of that, where it's our adults, and particularly our older adults, that have been more affected.
In fact, kids only account for 2% of all cases. Doctors say they don't expect that number to significantly increase when schools open because kids don't appear to be good at spreading the virus. Are kids as good at transmitting the virus as adults?
The data that's come out now seems to show that most transmissions occur from adults to adults or adults to children.
The younger you are, probably the less likely you are to be able to transmit the disease.
While many teachers are concerned about reopening school so soon, the 5 doctors we spoke to agreed. The benefits of being in the classroom far outweigh the risk of disease, but the key is to reopen safely.
We are not seeing transmissions when we're following some simple guidelines.
I think each school system is going to have to come up with their own guidelines because you can't just say that one city is just like the next.
All agreed guidelines should include rules for social distancing. Keep desks 3 to 6 feet apart and make sure desks aren't facing each other. Schools may want to consider holding gym classes outside.
In your perfect world of sending kids back to school, what would you like seeing set up in those school systems?
They should try to increase the airflow in the classrooms, try to distance as much as possible. I have been doing a lot of research looking into face masks. I don't think they're necessarily useful in elementary school children. They do provide protection, I think, for high school students.
Would you let your kids go back to school?
I will. My kids are looking forward to it.
Yes. Period. Absolutely.
Absolutely. as much as I can.
Without a hesitation.
Without a hesitation, yes.
I have no concerns about sending my child to school in the fall.
I would let my kids go back to school.
Dr. John.
So you hear top pediatricians all coming together and saying, one, COVID-19 does not appear to affect young people the way it does the elderly population, which is a complete flip from other respiratory infections, like for instance the flu, which usually has a very, not just a high case rate, but higher mortality rate, higher hospitalization rate amongst young people being shut in sick. That's not happening here. Apparently, young people in this country make up barely 2% of all total cases, positive cases. And then when we talk about deaths, statistically zero, and how transmission amongst young people seems to be nil. It seems to be mostly adults to kids is the prime form of transmission. And all of the top pediatricians all agree we need to reopen schools. It's very important, risk is very low, and they all even said across the board unanimously, I would send my kids to school. That was the story 3 weeks ago. I guess they can't hide the truth but for so long, and they can claim so long as we did a story on the other side, which is apparently the scientific fact, they can't claim complete bias, despite the fact that there's probably a total disparity in the number of articles you'll see in from MSNBC, NBC, CNN regarding the fear mongering they're putting out on the number of cases, and not as accurately giving the story about hospitalization rates. Yes, they may be testing positive. Are they showing any symptoms? And if, are they asymptomatic or are they showing mild symptoms? We need to know. They're not really getting that deep. I will say this, the CNN article I saw on Twitter today, and I'll be more than glad to put the link in the description box below on these articles and or news stories. They did say of the 1,000 new cases reported in the University of Alabama, no hospitalizations. Let me repeat that. No hospitalizations. So what's really going on here? What's the real story? Is this a virus that is okay for young people to be put back in schools? And if so, does this virus have minimal risk to young people? That's what we need to know. And we don't seem to be getting a straight answer from the mainstream media. And you may notice in the first story, there were no healthcare professionals talking about the fears of, what they saw in the picture in that high school in Georgia. And why are they coming after Georgia, by the way? Is it because the governor is a Republican governor? Like, oh my God, they're reopening face-to-face too soon, despite the science is saying it's okay. No, they need to stay in. Which is another reason why I say it's very important that we do vote this year, because as you can tell, mainstream media seems to have an agenda. Most of the Democrats have an agenda of keeping you locked in, keeping you in fear, not allowing you to try to restart your life, at least safely, despite the fact that the science agrees with the state of Georgia's decision to bring kids back to school face-to-face. So we really need to keep a watch on that. Again, all I'm seeing is a lot of panic and fear being pumped out, not a lot of fact-based science and or data and or at least truth as it pertains to how this virus truly affects younger people, younger adults. And the fact that the majority of younger people under the age of 40 even, so long as you're healthy, no comorbidities or pre-existing conditions that puts a toll on your immune system as is, can attain the virus and either be asymptomatic and or at worst mild symptoms. And then we also need to get into, I'll do probably on another video on the accuracy of these tests as well. What's really going on? Are these numbers, positive case rates, even accurate to begin with? But I just wanted to weigh in on the whole school debate and just, had to dispel a lot of this fear-mongering I'm seeing on Twitter and, on CNN regarding the reopening of a lot of these schools and universities, despite the fact that even if they can point to higher case rates, are they just case rates because of lab testing, or are people actually getting sick? And notice how they're conspicuously not mentioning the severity of the people's symptoms, if at all any, and or hospitalizations, because it appears to be a lack thereof. So they're just pumping out fear in my perspective. Let me know your thoughts on this. Like, share, and subscribe, and I shall talk to y'all later. Peace.